Welcome everyone to another episode of Take Back My Brain. Today I have a very special guest, a doctor that I admire deeply in his work with nitric oxide. Today we have Dr. Nathan Bryan, and we're going to talk about all things nitric oxide and the brain. And I'm really excited. So make sure you get out your pens and papers if you're in a place to take notes, because you're going to want to take notes on this because this is going to be life-changing. So Dr. Nathan, thank you so much for coming on. I appreciate you.
Laurie, thank you so much for having me. It's great to be with you.
Awesome. So kind of give us your background story, and then I want to know, because our listeners may not even know what nitric oxide is
Sure.
and how important it is to the body.
Well, I grew up in small town Texas. I always had an interest in science and medicine. I got an undergraduate degree in biochemistry from the University of Texas. From there, I went and got a PhD in molecular and cellular physiology at LSU School of Medicine in Shreveport. From there, I went to Boston. I trained as a cardiology fellow at Boston Medical Center, and then I was hired as faculty professor of medicine at University of Texas Health Science Center in Houston. It was really, that's where I started my independent research career. But I've always been involved in nitric oxide from the time I was a student. And really that was the focus of my research program at University of Texas Medical School in Houston.
That's awesome. That's awesome. So what is nitric oxide?
Yeah, it's a gas. It's a gas that's naturally produced in the body, but it's a signaling molecule. It's how cells in the body communicate with one another. It controls things like blood pressure and blood flow and circulation. It regulates tissue oxygenation, the delivery of oxygen by red blood cells to every organ, tissue, and cell in the body. It's how our immune system fights off bacteria and viruses, and part of our innate immune system. And in regards to the brain, it's a neurotransmitter. So in the brain, nitric oxide has really an enormous effect because it not only controls cerebral perfusion or the regulation of blood flow to the brain, but it's actually released by the neurons, and it's what we call a retrograde messenger. So it's conductance in the neurons. It's part of memory recall. It's part of the nociception process or pain sensitization. So really everything we know about the metabolic dysfunction in brain disease or neurological dysfunction can be traced back to insufficient nitric oxide production.
Okay, so what is it really? So you said it's a neurotransmitter and
Yep.
helps communication signals. So how does it play a role in, say, like serotonin?
Well, these are all kind of neurotransmitter peptides or proteins, for example, like serotonin. So there has to be communication within the neurons, right? And communication starts with adequate circulation and perfusion. So we have to kind of divorce nitric oxide's effect from, well, not divorce it, but really learn its perspective from both the vascular component as well as a neuronal component. In fact, there's two separate enzymes, one called eNOS that's found in the lining of the blood vessels, one called nNOS, or neuronal nitric oxide synthase, that's found in the neurons that are releasing nitric oxide that are affecting this. But the release of any hormone, whether it's testosterone or estrogen or dopamine or serotonin, is all dependent upon the secretory effects of the endocrine gland, no matter where it is, and its ability to produce nitric oxide. So it's nitric oxide that's produced that leads to the secretion of all hormones. So if you can't make nitric oxide, not only are you getting inadequate blood flow to that organ, so you have a poor sampling of the blood levels of hormones. So there's a dysregulation of hormone secretion, but also, you have a disruption of nitric oxide, which is a hormone itself. So whereas thyroid hormone is considered the master hormone regulator in the body, I would even argue that nitric oxide supersedes that, because without nitric oxide being produced, you don't get adequate circulation. You don't get adequate sensing by the endocrine glands to know how much hormone to secrete or what to secrete. So without nitric oxide, nothing works.
Right. So your thyroid won't work without nitric oxide is what you're saying.
That's right. So, but nitric oxide, again, let me make a point. Nitric oxide is not an end-all, be-all, cure-all.
Right.
Nitric oxide is foundational for everything else, but fixing nitric oxide is not going to fix your thyroid. And fixing your thyroid isn't going to fix nitric oxide. That's where I think the integrative physicians do the best job, because you have to look at root cause of all this.
Right.
But the root cause of most, if not all, age-related chronic disease can be traced back to a loss of nitric oxide production, which leads to decreased blood flow, focal ischemia, hypoxia, increased inflammation, immune dysfunction, and oxidative stress. And those are hallmarks of every single chronic disease.
So if we want to age better, we want to make sure that we have enough nitric oxide.
Well, I think that the evidence is clear that your body cannot and will not heal or perform optimally until you restore the production of nitric oxide.
Okay. So what causes the reduction in nitric oxide in our body, in our brain?
Well,
I mean,
seems
there's
like
probably a ton of things, right? But let's name maybe like the top five.
well, it's the American lifestyle. It's the
Fair
Western
enough.
lifestyle, right? It's
Yeah.
it's lack of exercise. It's a poor diet. Interestingly enough, use of mouthwash. We published on this probably 10 or 15 years ago. If you use mouthwash, you kill the oral microbiome, shut down nitric oxide production. You see an increase in blood pressure. You lose the protective benefits of exercise. Fluoride is an antiseptic. You have to get rid of fluoride toothpaste. It's an antiseptic. It's a neurotoxin, and it kills your thyroid function.
Right.
Then the
So
other
you're saying
main
there's a connection between the microbiome and nitric oxide production. That's what you're saying with if
That's
we're
right.
using a specific type of mouthwash.
Right. So what we understand today, fast forward from where we were 30 years ago, is that we now know that the human body produces nitric oxide from two primary pathways. One is this enzyme we discussed in the
Mhm.
lining of the blood vessels and in neurons, and the other is from our microbiome.
Okay.
The bacteria that live in and on our body, part of their job is to produce nitric oxide gas. And the oral microbiome is responsible for converting nitrate in your diet into nitrite and nitric oxide. But if you don't have the right oral bacteria, you don't get nitric oxide production from this pathway. So
Wow.
if you have endothelial dysfunction and the enzyme is uncoupled, and you eat a poor diet or you use mouthwash or antacid, you completely shut down total body nitric oxide production. And
Right.
now you start to get into trouble. You start to develop erectile dysfunction, you get high blood pressure, you develop insulin resistance, type 2 diabetes, mild cognitive disorders, you lose your memory, vascular dementia, Alzheimer's. The whole gamut of metabolic age-related disease can be traced back to a loss of nitric oxide.
So that's a huge domino effect.
Yeah, look, it's really considered, the holy grail in cardiovascular medicine because, as I mentioned, you cannot get to the root cause or fix any dysfunctional organ or symptomology until number one, you restore blood flow, which nitric oxide does. Number
Right.
two, you mitigate the inflammatory response, which is happens in all chronic diseases. Nitric oxide inhibits inflammation. And then you
Mhm.
have the oxidative stress and immune dysfunction that occurs in the lining of the blood vessel in the organ itself. And nitric oxide shuts down oxidative stress, superoxide production, and inhibits the immune dysfunction that occurs in the lining of the blood vessel.
Wow. Wow. So that's a lot. That's a lot to take in. So nitric oxide is important for everything, right? You said it wouldn't fix, everything, but that's not a foundational nutrient, then it's hard to get well without it. Am I correct in saying that?
That's right.
Yeah.
Yeah, so we have to be able to deliver oxygen and nutrients to every organ, tissue, and cell in the body. Without oxygen nutrients, all cells fail. It doesn't matter if it's cells in the brain or cells in
Right.
the stomach or the liver or the skeletal muscle. They cannot do their job. So that's what nitric oxide does. It adequately provides nutrients and oxygen delivery, controls inflammation, prevents oxidative stress, and the immune dysfunction that occurs in chronic disease. So
Right.
again, it's foundational. Your body cannot and will not heal until we restore the production of nitric oxide. And then you can begin to address other physiological issues.
Right. So you were talking about, mouthwash, and then you said, antacid. So you're talking
And
like
that's,
proton pump inhibitors.
yeah, the PPIs, the proton pump inhibitors, are some of the most dangerous drugs on the market.
Yeah.
It's now known that people that have been on PPIs for 3 to 5 years have a 35% higher incidence of heart attack and stroke because these
Really?
drugs completely inhibit nitric oxide production. And then just a couple of months ago, a report came out that people who have been on PPIs for, I think, 4 years had a 40% increase in Alzheimer's and vascular dementia. So
Mhm.
mechanistically, we know that PPIs specifically shut down stomach acid production. They inhibit nitric oxide production in the lumen of the stomach, and they shut down nitric oxide production in the lining of the blood vessel because they lead to an increase in a molecule called asymmetric dimethylarginine, or ADMA, which shuts down vascular production of enzymes. And the consequences are deadly. 35% more heart attacks and stroke, 40% higher incidence of Alzheimer's. So, these drugs were never approved by the FDA to be taken chronically, only for 3 to 5 days. But yet some people have been on these PPIs for 10, 15, 20, 30 years.
Yeah. Yeah. I get
And
clients all the time. They've been on
yeah,
them for years, for years. And
they're deadly. There should be a black box warning similar to what there was on Celebrex and Vioxx. The evidence on PPIs and adverse cardiovascular events are greater than the Celebrex and Vioxx, and yet they have a black box warning. PPI should follow the same suit. It's dangerous.
right. There's so many over the counter, options
No,
for them.
that's right. You don't even need a prescription for these drugs anymore.
Yeah.
You
You
can
can
get
like
Prilosec,
black box
Prevacid,
those.
Nexium, OTC.
Yeah.
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 And we got Larry, the cable guy, out there telling us we should take our Prevacid, Prilosec, OTC every day.
Yeah. He's a picture of health.
Yeah, right.
Yeah. Yeah. So when you're talking about all this cardiovascular, effect as well, what do you do? What do you do when somebody is, say, on like a cholesterol medication, so like a statin, and they're on a PPI. Let's kind of explore that a little bit, because clearly that affects the brain as well.
For sure.
But when your cholesterol is low, your nitric oxide production is low. Am I understanding that correctly?
Now, that's correct. If I wanted to make you chronically ill, I would put you on a statin and get your cholesterol below 200, and I would give you a proton pump inhibitor. And yet, that's the standard of care in medicine.
It is.
To me, it's no surprise why Americans are the sickest people on the planet. Everything we do is shutting down nitric oxide production. So if you have patients on statins, and look, we're not giving medical advice here, they have to have a conversation with their prescribing physician.
Correct.
Just to have the conversation, how do we get off medication? Because that's never a conversation physicians and patients have. It's always, if this doesn't work, come back, I'm going to put you on more medication. By the way, you're going to continue to take this one, even though it's not working, making you better. So now we've got people on half a dozen different medications, over prescribed, over polypharmacy, and it's making people worse. So we have to start having the conversation of getting to the root cause of their problems and then getting people off of drugs. So cholesterol lowering medication, you can stop cold turkey. You know, the half-life of these statins are several days.
Sure.
And so you have to get these out of your system. Your body makes cholesterol when it needs it. If you're taking a statin, it prevents your body from making cholesterol that it needs.
Right.
You need cholesterol to make a viable cell membrane that elicits cell signaling. You need cholesterol for normal brain function. And so those you have to get off. We need cholesterol. The body makes it upon demand, so there's no need to inhibit it in the body. And two, cholesterol doesn't cause heart disease, so there's no real reason for anybody to be on cholesterol-lowering medication. The primary, secondary, tertiary prevention trials are not convincing that it actually does anything. In fact, now there's higher incidence of diabetes. These are mitochondrial toxins, higher incidence of cancer. So statins, really bad drugs. I encourage everybody to try to get off of them and talk to your physician.
Right.
Now, PPIs are different. You can't stop these drugs cold turkey because you get a rebound effect.
Right, right.
So you have to slowly wean off of these drugs. And I tell people, whatever you're taking today, take half a dose. Take a half dose for a week, and then take half a dose every other day for a week. And then you can slowly wean off of these. And now your body can actually do what it's designed to do, break down proteins into amino acids, absorb nutrients, and you get rid of the GERD, and you get sufficient stomach acid production.
Right, right. So I want to swing back around a little bit to the cholesterol piece, though, because it's so important. Because I've heard you talk, and I'm in complete agreement and understanding of this. Like when I see somebody's cholesterol 200, or especially under 170, like that's a huge red flag to me. Like I always look at the person, I'm like, this is it. It puts you at increased risk for, blah, 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 blah. Right?
Everything.
So increased risk for heart attack, stroke, dementia, Alzheimer's, everything that you were talking about. And yet we still have this message within mainstream medical that if you have cholesterol, say 207, we better put you on a statin. Yeah. And I've seen people, get aneurysms from this. I had a family member whose cholesterol was down to 90. It was down to 90, and he ended up, with an aortic aneurysm. And I know that had to be, why that happened, because he didn't have enough cholesterol to protect his cell membranes. And so all of his membranes were weak. Right. And so when you're shutting down cholesterol, that shuts down the nitric oxide production. And, you're talking about this whole cascade. I just really wanted to reiterate that, and whatever you have to add to that, because I think that's such a big key piece that people don't understand.
Yeah, so there's a number of side effects and bad things that happen from lowering your cholesterol. Number one, you need cholesterol to make estrogen. You need cholesterol to make testosterone. You need cholesterol to make vitamin D. If you don't have enough cholesterol, you can't make testosterone, estrogen, or vitamin D. And we have a pandemic of hormone disorders in men and women. Right. A pandemic of vitamin D deficiency. And it's all because clinicians are trying to get your cholesterol below 200. But in relation to nitric oxide, you need these lipid rafts, the cholesterol molecules in the cell membrane, so you allow for membrane fluidity, so you can allow the transmembrane signaling. When you get your cholesterol below 200, you lose that rigidity, you lose the anchoring of these protein complexes in the membrane, and the signal transduction goes away. And in fact, we know that nitric oxide enzyme is tethered to the membrane through a protein complex. If your cholesterol gets too low, the complex falls apart, and you become nitric oxide deficient. Wow. So we have to start the conversation on, and here's the frustrating thing. If you have a heart attack and your cholesterol is 210 or even 200, they're going to put you on a cholesterol lowering medication no matter what.
No matter what, yeah.
50% of the people who have sudden cardiac arrest have normal cholesterol levels. So cholesterol does not cause heart disease, and lowering cholesterol below 200 is a really bad idea that puts people on on a trail to chronic illness for the rest of their life. So they actually become very good customers to pharmaceutical business, but yet at the sacrifice of their own health.
Right, right. So how do we know if we have too low of nitric oxide? What do we do?
Well, we rely on symptomology, because there's no lab test we can run. It's not like your cholesterol or vitamin D where we can pull blood and tell you what your nitric oxide levels are, because once nitric oxide is produced, it's gone in less than a second.
Okay.
So we rely on symptoms. So if you have an unsafe elevation in blood pressure, that's typically a sign of nitric oxide deficiency. If you're developing sexual dysfunction, either a man or a woman, it's a nitric oxide problem. You can't dilate the blood vessels of the sex organs to get engorgement. It's a loss of nitric oxide. The other, if you have metabolic disease, insulin resistance, type 2 diabetes, that's a nitric oxide deficiency, because nitric oxide is part of the insulin signaling and glucose uptake pathway. And if you have exercise intolerance, if you get winded going up a flight of steps, or if you can't, walk briskly for 20 minutes without tiring, then that's a nitric oxide problem. So those are kind of the top of the list. But we look at the whole clinical picture, and really almost anything can be related to a loss of nitric oxide function. So then we start repleting nitric oxide, and then see how the symptoms get better, and then you can start addressing other problems.
Right, right. So it's very foundational for recovering from whatever condition you might have.
That's right.
Right, right. So there's a lot of nitric oxide supplements out there on the market.
Yeah. It's a circus.
It is a circus out there. And so, like weeding through this, and one of the reasons I have you on is because I really love your products. I mean, it's amazing, and I like it, and I take it almost all the time. And so, how do we weed through that? Because you've done some Instagram videos that I've seen where you've kind of called out other people, other companies. I'm sure that you haven't been super popular on that. Right?
The truth hurts sometimes.
Yeah, truth does hurt sometimes. So how do we weed through that? And what are we looking for, when we're looking for nitric oxide? And then what's the best delivery method? Because I know you have several options on that as well.
Well, you make a good point. There's hundreds of companies out there selling so-called nitric oxide products. This started in the late 90s when a Nobel Prize was awarded. Nitric oxide became popular and mainstream. And now the first kind of type of products were arginine-based products.
Right.
And now we know that these products typically don't work at all. Your body's never deficient in arginine, so it makes no sense to supplement. Furthermore, there's clinical studies out there showing that if you take a patient with endothelial dysfunction, takes high-dose arginine, they actually get worse. Post-infarct patients have a higher mortality. Patients with peripheral artery disease actually get worse. Intermittent claudication gets worse. Quality of life gets worse. So arginine should not.
Is that because they can't break it down?
Well, it's because if you have an uncoupled NOS enzyme, and we call this endothelial dysfunction, and you give high-dose arginine, this enzyme now produces superoxide, which is an oxygen radical, instead of nitric oxide.
Gotcha.
So it actually exacerbates their underlying condition. So arginine products should not be given to anybody with endothelial dysfunction. Now, who is that? People with blood pressure issues, people with erectile dysfunction, people that were insulin resistant. So arginine is not the solution. And then there came the beet rush back in the 2012. And
I took a lot of that, yes.
Yeah, unfortunately, 99% of the beet products out there don't do anything in terms of nitric oxide. They're what we call dead beets. All they do is turn your pee and your poop pink and discolor and cause a lot of anxiety. So we understand how much nitrate you need. We understand how the body converts that into nitrite and nitric oxide. But again, most people don't have the right oral bacteria, because 2 out of 3 people use mouthwash in the US. So you can take beets till the cows come home, but if you don't have the right oral flora, you're never going to convert it to nitric oxide. Again, you're just going to sweat it out. You're going to excrete it in your urine, in your feces. So what you look for products backed by science. I've been 25 years in the nitric oxide space. And so I'm not only the inventor of a lot of products, but really made a lot of innovative and seminal discoveries in terms of how nitric oxide is produced in the body. So what we do is unlike any other company out there. If your body can't make nitric oxide, we do it for you. And so let me just repeat that. Nitric oxide is a gas. How do you deliver a bioactive gas in a capsule?
Right.
Well, you can't. How do you deliver bioactive gas in a gummy or a chew? You can't. The only way you deliver nitric oxide is through our orally disintegrating tablet that, as it's slowly dissolving, it releases nitric oxide. So we designed this to have a specific residence time in the mouth, and we generate a specific amount of nitric oxide that we can quantify, we can detect, we can verify, and it's vasoactive. And we do this in terms of a fermented beet powder. So even if you don't have the right bacteria, or even if you use mouthwash, even if you're using antacids, our products generate nitric oxide. We don't rely on endogenous systems in individual patients to do it, because their underlying problem is they can't.
Right.
So if they can't make testosterone or estrogen, what do? You give them testosterone. You can't make nitric oxide, then we got to give you nitric oxide. And that's what we do, and no one else does it. Everybody else is pretending. They're taking advantage and really bastardizing the science that we spent 25 years trying to develop and advance. And they're trying to take us back 20 or 30 years, convincing people that you can get nitric oxide in a gummy or a chew or a capsule. And it just doesn't work. Biochemically, it cannot work. Physiologically, it cannot work. And even the physical chemistry of nitric oxide just goes against anything they're trying to do.
Right, right. And you have several different delivery methods, right? So you have the tablet, you just developed a skincare line. Can you tell us about that? And how does that help?
That comes from a personal story, because my dad's a paraplegic from a car accident in 1984.
Oh, okay.
So we've been dealing with skin breakdown and pressure ulcers on my dad for many, many years. And he developed a non-healing ulcer, a decubitus pressure ulcer, back in 2014, 2015, that the wound care doc said we would never heal. So I knew the power of nitric oxide. It's antibacterial, would kill an infection, and would actually get blood flow to the wound. So I started developing a topical nitric oxide. I would develop a nitric oxide releasing gauze that we would put in the wound. And make a long story short, we actually healed this non-healing wound. So then I thought, wow, and all of his wound care docs were like, I don't know what you were doing, but whatever you did we've never seen it before in wound care.
Wow.
So we now have a drug going through FDA for diabetic ulcers and wound care. But obviously that takes time. So we brought this product to market as a skincare product. And really, if you think about it, the skin is an organ, right? Just like the heart, just like the brain.
Just like everything else, yep.
And without sufficient blood supply, that organ fails. So we get fine lines and wrinkles, we lose hydration, we lose collagen, we get age spots, acne. So I developed a dual chamber nitric oxide topical, the only topical nitric oxide delivery in the world. So when you apply this to the skin, it liberates nitric oxide, it diffuses into the dermis, and we can recruit capillaries, we can improve blood flow. We've got 5 published clinical trials. It's really a new category in skincare.
Yeah.
Fine lines and wrinkles go away, tone, texture, clarity of the skin improve. Very effective in clinical trials with acne, rosacea, any type of dermatological condition. But again, it makes sense. What does nitric oxide do? It gets blood flow to the organ. It decreases inflammation, oxidative stress, and immune dysfunction. And it actually improves cellular turnover. We mobilize stem cells to actually go and repair and replace dysfunctional cells and tissues. So you improve cellular turnover. So you're improving the body's ability to heal and replace old cells that don't work.
That's incredible. That's incredible. Yeah. So you mentioned
most skincare it's really, I never imagined that being skincare, but if you think about this, most skincare products on the market are designed to hide or mask the blemishes.
Right, you just cover everything up. Yeah.
Yeah. So what we do is get to the root cause, right? What's the root cause? Well, decreased blood flow. We've lost the ability to mobilize our own stem cells, because without nitric oxide, you can't mobilize stem cells. So now when we provide nitric oxide, if your body can't make it, we do it for you. Then we allow everything to work properly. The skin actually works as it's designed to do.
Right. I love it. So when you say stem cells, so I'm thinking, a lot of people get injected with stem cells.
Yeah.
And most of those people who are getting those injections are going to have a low nitric oxide level in their body because of, underlying conditions. And usually it's degeneration of some sort. So if it's degeneration, then there's low nitric oxide.
Right.
So could you make the claim that if you were to boost your nitric oxide levels and you got the stem cells, that you would have a better result with that?
Absolutely. And we have clinical data to verify and corroborate that statement. So we can, and we published this in 2011. We have a pediatric patient had an inborn air metabolism. Our nitric oxide, we mobilized his stem cells. We reversed his heart disease within 5 months. We reversed his kidney disease within 5 days.
Oh.
And so we've been able to replicate that in a number of stem cell clinics, whether you're taking autologous stem cells from your own bone marrow or fat-derived stem cells. If you take cells from a sick patient and put them back in a sick patient, what are we
going to get, right?
So what we do now is we develop protocols where if people are getting stem cells, whether autologous or off-the-shelf type cells like exosomes, then we have to restore the nitric oxide production in these patients. So we get the nitric oxide in them, we open up the blood vessels. Now, if you're taking IV stem cells or topical stem cells or exosomes, you're going to get better delivery of everything you're doing. And nitric oxide is the molecule, the niche that tells our own stem cells where to go, what to become. And without nitric oxide, you don't get the signal. And the stem cells, furthermore, can't even get to the region of the dysfunctional tissue, because every dysfunctional tissue has hypoxia and ischemia.
Right.
So there's decreased blood flow to it. So it's like a traffic jam, right? If you're trying to get to the fire trucks can't get to the fire if there's a traffic jam. And that's what happens in chronic disease. There's insufficient blood flow, so you can't deliver either the therapeutic stem cells or whatever you're trying to deliver to that particular organ without nitric oxide. And that's what we do.
Right, right. So how does it work with somebody who say has like a skin cancer? Are there studies with nitric oxide and reversing skin cancer issues?
Not really, not that I'm aware of, but cancer doesn't like oxygen, right? Cancer only grows in a low oxygen, low pH environment. That's called the Warburg effect. So you get uncoupling of the mitochondrial transport chain, you get oxidative fermentation. And so that's the hallmarks of cancer. So if you recouple the electron transport chain, you improve mitochondrial energy production, improve the efficiency of oxygen utilization, and get oxygen to a hypoxic cancer cell, then by definition, the cancer can't survive. So nitric oxide is probably one of the most anti-cancer molecules there are. Now, there's camps out there that say you never want to give a pro-angiogenic factor to a person with metastatic disease, because angiogenic means growing new vessels to that tumor.
To the tumor,
But
sure.
but the difference is the tumor controls its own oxygen environment. So it deliberately creates a hypoxic, low oxygen environment. If you give nitric oxide, it opens up those blood vessels, oxygenates the tissue, the tumor, recouples the electron transport chain, and you basically overcome everything we know about cancer.
Wow. That's incredible there.
But you also, so let me just make a statement. You have to first ask the question, why did they get cancer? There's always a reason people get cancer, and nitric oxide is not going to overcome that reason
Those
unless
are
you
the
address
reasons.
it.
Yeah.
Yeah. So the broad statement is nitric oxide is foundational, but again, I'm not saying that nitric oxide is the cure for cancer or the cure for Alzheimer's or diabetes. I think we can make some progress in it.
Yeah.
That's right.
It's a piece of the puzzle, just like so many other things, right? Like water and,
That's right. I wish it were that simple. I wish there were a silver bullet.
I wish it were too. That would be amazing. So what can people do to naturally increase their nitric oxide without taking supplementation?
Yeah, look, in a perfect world, we don't need supplementation, right? We give the body what it needs and the body heals itself. So I tell people you only have to do two things. Stop doing the things that disrupt nitric oxide production, and then start doing the things that are clinically proven to promote it. So if we stop using mouthwash, if we get rid of fluoride in our toothpaste, get rid of fluoride in our drinking water and the water we bathe in and cook in, and get off of antacids, now the body is actually primed to do its job. Now we can start throwing in some more green leafy vegetables. 20 to 30 minutes of moderate physical exercise a day can stimulate nitric oxide production. 20 to 30 minutes of sunlight. There's certain wavelengths of light that will stimulate nitric oxide release, or an infrared sauna. I'm a big fan of infrared light.
Right.
And usually that's enough. Stop mouthwash, stop antacids, get rid of fluoride, eat a balanced diet in moderation, and get some sunlight. Now, in a perfect world, that would be sufficient. But we now know that the food we eat is depleted of many nutrients. So we become macro and macronutrient deficient. A lot of people are using sunscreens and prevent sunlight absorption. And so sometimes we need a little bit of help. And that's where we come in. We provide a physiological dose of nitric oxide that if your diet isn't working, if you can't get exercise, or if you want to make excuses, Americans are programmed to take a pill and not want to change their diet or lifestyle. So we provide that, but it's not an excuse not to take corrective, proactive measures to improve your own body's production of nitric oxide.
Gosh, I love that so much. Thank you. This has just been a great conversation, Dr. Bryan. I really appreciate your expertise and your integrity, and it's just everything. I love following you, and you're going to be a real asset to all my listeners. So thank you so much. I really appreciate that.
Well, thank you. And I appreciate the opportunity and the opportunity to educate, because as you brought it up, there's a lot of confusion out there. There's a lot of misinformation. And I think I see it as my job and responsibility and really obligation to maintain the integrity of the science and make sure that people get the right information and they're not fooled by deceptive marketing and fraudulent advertising.
Absolutely. So I will have all of Dr. Nathan Bryan's information in the show notes, where you can get all of his products. And you have a new book, right?
I have a book coming out probably in December or January called The
Okay.
Secret of Nitric Oxide, Bringing Nitric Oxide to Life. So be on the lookout for that. We'll talk about our discoveries and really try to bring the global awareness around nitric oxide.
Boy, I can't wait to read that one. That'll be a good one. So awesome.
Thank you.
Thank you so much for being here. Thank you everyone for listening. Make sure that you like, subscribe, follow, ring the bell, share with family and friends. This is such important information. I appreciate all of you, and I will see you in the next episode.
Thank you.